to flex the head, okay, rotate, and then you flex. Rotate, and then you flex. And then you can palpate for the sternocleidomastoid. Okay? I think that's very important, especially for us doctors, okay? You rotate, and then you flex. You rotate, and then you flex. And then you identify the anterior and posterior borders of the sternocleidomastoid. Why? As I mentioned a while ago, look at the sternocleidomastoid. If you follow the belly of the sternocleidomastoid, you will avoid the carotid artery, which is medial, okay, to the sternocleidomastoid. You avoid the external jugular, okay, which is lateral to the sternocleidomastoid. So this is the actual patient of mine. So I'm trying to see that's the pulsation you see here. Okay, that is the external jugular vein. Okay, if you hit that, you will have a very big bleeder. Okay, you avoid that. That's the sternocleido. I ask the patient okay, to rotate the head. Okay, see it's contracting. You see the sternocleidomastoid? And I put the injections directly over the sternocleidomastoid muscle. You have here the sternal component, and you have here the manubrium component. Okay, I stay on top of the muscle. I try to avoid the jugular vein. Very old patient, very thin, you can see. Papat, 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 pulsating. So, common sense, you avoid. Okay, to avoid. So, landmark, the higher increase, that's the first landmark I look for the cervicovental angle. And then landmark number two, I look for the thyroid lamina. How do you palpate for the thyroid lamina? You look for the Adam's apple. Everybody, you touch your neck. Touch your neck. See? You can feel the Adam's apple. Okay? And then below the Adam's apple is the body. That is my injection point. And then number three is between 2 and 4. So I identify 4, which is 1.5 centimeter above the sternal notch. Okay? So number 3 point back is between 2 and 5, 6, 7, 8, 9, 10 is on top of the sternocleidomastoid muscle. You understand? 5 and 6, you are more prone to hitting the external jugular vein because it crosses the muscle. Okay? In its cranial portion. You have to be observative. Okay? You see, you look, you avoid the vessel. It's very important. Okay? So I look, there's a technique that I do. I bend the needle, okay, in cases where you have difficulty, okay, to ensure that you are in the correct plane. I bend the needle about 20 degrees. Okay, there's a technique I'll show you. And I inject into the skin and then I pull the skin. This is the guarantee that I am very superficial. I am in the skin and I am not in the vein artery or very deep into the area, especially in the neck. So I have my landmarks. So back number one is the hyoid crease. Very easy to locate. Ask the patient to look down, down. You have that crease, that's one. Number two is below the Adam's apple. Okay. Back number three is between 2 and 4. So I look for number 3, right there, just below the cricoid. Then number 4 is about 1.5 centimeters above the sternal notch. Okay. And then 5, 6, 7, 8, 9, 10, three injection points along the body of the sternocleidomastoid muscle. Okay? You have to identify that because your muscle will protect you from the major muscles. Okay? That is very important. I do the same thing on the other side. Okay? Look at this technique. So I bend my needle. So I engage my needle into the injection point. Okay? I inject half of the needle and I try to hit the skin. When I hit the skin, this will guarantee that I am in the skin or intradermal. Okay? You do not want to go very deep because very thin. What you have there is the muscle. Okay? Sometimes with the muscle is a vessel. Okay? So you go very superficial. You inject 0.2 ml. Okay? So back number one for the test. And then back number two, look. I look for the thyroid cartilage. It protects my product without spilling into the area. So I place 0.2 ml as well. I inject, I look, as I inject, I see the bleb. The bleb is more obvious in the neck because the skin is very thin compared to the face. So you inject, you see the bleb, Very good. You want to see the bleb. They go home with the bleb, stays for 2 days. Some patients, 3 days, 5 days. But it's okay. You understand? No need to massage. No need to massage. Spontaneously, with the light based quantifier demo after injection, within 15 to 60 minutes, profile will start to spread. Okay? Along a natural plane. No need to massage. I just press to ensure that there is no bleeding. I stay lateral again. Always, I want to make sure I'm in the belly of the sternocleidomastoid. And then I place my injections. I can go 10, 9, 8, 7, 6, 5, 10, 6, 5, 9, 8, 7, depending on your fancy. Okay? So as long as you get it into the natural plan. Okay? I show you some cases. Okay? So, in this case, the patient has atopic dermatitis. Okay? She's been complaining of extremely dry skin. Very dry skin. She comes in periodically, quarterly from a clinical field.